So today I'm going to be talking about my tilt table. Woo! And I don't know if you've seen my video about my POTS diagnostic journey, but go to the iCard, watch it. I wasn't very specific about what happened, but I'm going to go through everything step by step for those who are interested in those clinical details, because they're kind of fun to share and talk about. So I'm gonna pull out my phone. You guys might see me look down. I'm gonna have my chart up because I want to reference specific things. So just give me 1 minute. Okay guys, sorry about that. So I had my tilt table test done out in Milwaukee, Wisconsin. I'm not going to disclose where specifically, but I did get it out done in Milwaukee, Wisconsin. I'm going to explain what happened and then I'm going to read these results to you. So basically what happened is I arrived there really early in the morning. I hadn't taken any of my meds for weeks. They took me into a room and my dad came with, so he was also there. They prepped me, they put an IV in, and then they wheeled me down to the tilt table room. Now the tilt table is basically like my phone going like this. So they lay you down like this, and then they go, hey, how you feeling? And then once they realize, like, they know how you're feeling, they hear about it, then they tilt you 90 degrees. So basically like this, so you're standing up.
Hey guys, Editing Brielle here. So I just really quick want to give you guys a clinical explanation as to what a tilt table test is, so that you guys can kind of better understand what this test is for. So if you feel like faint or lightheaded, your doctor might use a tilt table test to find out why you feel that way. During the test, you lie on a table that is basically, a table, so it's straight. And then what'll happen is after you have your blood pressure and heart rate regulated, they will slowly tilt you upwards to about 70 degrees, and they'll leave you there for a few seconds to see if your heart rate or blood pressure go up or down. And that is kind of how they determine what your issue is. So for people with POTS, they're looking specifically for a fall in blood pressure or an increase in heart rate. So if you don't have both of those things, or the increase in heart rate is the one that really diagnoses POTS, you may or may not have the fall in blood pressure. So Michaela had a slight increase in heart rate, but she didn't have the blood pressure. So she'll kind of talk about that a little bit more, but that's kind of what a positive tilt table test for POTS would look like.
So I went in and I was laying down and I'm like, I'm good. So I was good, and then they tilted me up, and then everything just went. I felt dizzy. I felt like my heart was pounding out of my chest. I felt numb, but I guess I didn't explain that to them because I didn't really know what numb and tingly really meant. And then I stood there, I guess, for a little bit, and then they lowered me back down after I denied 5 or 7 times I didn't want the heart accelerant med because that sounded like a bad time. Basically after that I went back to my room, and then I asked the doctor, because I had talked to the emergency doctor when I went to the emergency room in that January of 2018. If you haven't seen my previous video, go watch it because I talk about that stuff there. But the emergency doctor said, have you heard of POTS? So I asked this doctor, I said, is it POTS? And he literally left the room, was walking away, and went, sure. So I'm going to read to you guys the clinical results of this test. Impression. Positive tilt table test with evidence of postural dizziness replicated with elevated heart rate consistent with postural orthostatic tachycardia syndrome. Possibility associated neurocardiac dysfunction is likely.
Really quick translation there. Neurocardiogenic dysfunction is referring to neurocardiogenic syncope, which is another type of syncope, or there's also neurocardiogenic near syncope. Basically what that means is there's a nerve in the back of your head called the vagus nerve, and that can cause dizziness and fainting when it has issues. So if you are afraid of blood and you pass out when you see blood, that's likely the vagus nerve. Or if you get anxious and you pass out, or you get anxious and you get dizzy, that is also related to the vagus nerve. Things like standing for too long, that is vagus nerve related. So that is what that is referring to.
Recommendations. General measures to avoid dehydration have been reinforced, including counter pressure techniques were discussed by me with the patient and her father also. I would also recommend starting Florinef 0.1 milligram daily. Clinical follow-up is recommended. So basically he's just saying don't get dehydrated and do those weird counter pressure techniques. So they basically went through the brief history. They said, I have no prior history of structural heart disease, has recurrent dizziness, lightheadedness, and near syncope episodes as well. Baseline echo showed normal ejection fraction with no underlying structural heart disease as well. Baseline echocardiogram was also unremarkable with any evidence of manifestation, preexistence, or bundle Bryant's block. She was advised to tilt table to evaluate for neurocardiogenic syncope. Complains mostly of symptoms with postural dizziness. Procedure was discussed by me. Risks, blah, 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 blah. Technique. This is the important part. The patient was brought to the electrophysiology lab in a non-sedated fasting state. Non-invasive blood pressure cuff was applied to the right arm. In the supine position, the heart rate was 98 beats per minute and the blood pressure was 127/78. So I was tilted to about 70 degrees. She was tilted to 70 degrees immediately on tilt. The patient complained of dizziness, lightheadedness, similar to what happens, and her heart rate went up to 117 and then 126 beats per minute. The blood pressure was 121/73. Over the course of the next 14 minutes, the patient's blood pressure remained between 126 and 130 systolic, and heart rate was 120 to 124. She says she feels these palpitations at home in the upright position, given that there is symptom replication of her postural dizziness with increased heart rate suggestive of postural orthostatic tachycardia syndrome, although there was no clear-cut orthostatic hypotension demonstrable with symptoms replicated.
Just another quick translation here. So what that means is that her heart rate did go up significantly enough where they were like, okay, she might have POTS, but her blood pressure did not drop. So normally in a POTS patient, you would see the blood pressure drop, but not always. Usually that's more common in people who have Ehlers-Danlos syndrome or like orthostatic hypotension, which that means that when you stand up, your blood pressure goes down.
A superior was not initiated and she was brought down to supine and made a uncomplicated hemodynamic and neurovascular recovery. For people who are not, used to reading these results, what that means is she didn't show any blood pressure decrease, which is normally what you would see in POTS. So she didn't show any blood pressure decrease, but she did show a slight heart rate increase. And slight high blood pressure.
And slight high blood pressure. So she didn't meet the criteria for POTS because of the fact that her heart rate didn't go high enough.
So that begs the question, I know a lot of people are about to be like, what the fuck, dude? Why do you walk around saying you have POTS?
She does have an increase in heart rate. It just isn't exactly POTS. So her doctors treat her as if she has POTS in order to decrease the symptoms that she's having.
And why would I walk around saying that I have POTS? Well,
because that is the closest condition that makes sense. So just a quick editing note here. We have been looking into getting Michaela further testing to see what else she might have. She did have this tilt table test at a different hospital system than the one that she sees now. So we're looking at maybe getting her another tilt table test and maybe looking into something like neurocardiogenic syncope or near syncope, because she doesn't pass out very often. She hasn't passed out for a couple of years, luckily. So something like neurocardiogenic or vasovagal syncope or near syncope, or maybe hyperadrenic POTS, which is the condition of POTS but with a high blood pressure, because she does experience high blood pressure relatively often, and that usually correlates with her dizziness symptoms. So we're looking into further testing, but testing takes a while.
So that is my tilt table clinical video. Do I want another tilt table? Yes. I don't think that walking away from something and just being like, sure, let's treat it like that, is necessarily the right thing to do. I wish that we would have had a conversation talking about all the options instead of only the options the doctors thought was reasonable. In the future, I would like to get another tilt and maybe try the meds this time. I'm not here to say, well, I'm just going to choose to be diagnosed with POTS and just live my life with chronic illness, because that's not it at all. I'm definitely suffering in my own ways. There's not a lot I can do about it. And the doctor said, you know what, your symptoms are POTS-like. Okay. we go with it. So anyways, thank you guys so much for watching, and if you enjoyed this video, subscribe, click the like button, comment down below. Peace out, Girl Scout.